Welcome home to USA Global TV and Radio, a place where dreams take flight, with authentic storytelling, diverse perspectives and meaningful conversations, where global stories unite and bridges are built beyond all borders. Discover world-class education, entertainment, hope and inspiration. Together, we're building bridges worldwide. Subscribe to our channel, USA Global TV. Download our app, USA Global TV. Be our guest or join our team. Visit usaglobaltv.com. Thanks to our founder and executive producer, Dr. JACALYN KERBECK. Music score by Yeffy Tang from Cloud Road Music. Voiceover artist Mike Porter. Creative direction by Paul Garcia. USA Global TV and Radio. Your home for global connection. All rights reserved. This video and its contents are the exclusive property of USA Global TV and Radio. Unauthorized use, duplication or redistribution in any form is strictly prohibited.
Good morning, good afternoon, and good evening. Welcome home to USA Global TV and Radio, where we proudly provide world-class education, entertainment, hope, and inspiration. I'm Dr. JACALYN KERBECK, and our show today is The Business Show. We are going to be talking about AI. We're going to be talking about trust. We're going to be talking about identifying fraud and so much more. So please do stay tuned. We've got a backstage filled with people, so let's get the show started. My co-host, dear friend, and mentor is Mr. Al Cini. Let's welcome him to the program and find out what he's been doing with ProFit for Teams. Hello, Al. Welcome to the program.
Hey, Dr. Kerbeck, it's a pleasure to be here. Thank you for inviting me, as always. And boy, the people backstage are bubbling with enthusiasm, and I can't wait to talk to them about Life ID.
I love it.
But meanwhile, with ProFit for Teams, we're building teams, developing organizations. I'm having so much fun with it. Words fail me at the moment, but I'll have more words later. Thank you very much.
When words are failing, you have a smile on my face.
That's
because
scary.
Everything you say is so important. So we've also got Richard Allen backstage. Tell us a little bit about Rich.
Rich Allen is one of the brightest guys I know. I mean, and he's connected, especially in education, but in just about everything else too. And he's always on the lookout for great ideas. And today's interviews are, I think, a really great example of that. So why don't we bring him out and get started with our guests?
Fantastic. Welcome to the show, Rich. Nice to see you.
Good to see you both again. It's a pleasure to be here. And I love the guests you bring on the show. And, you know, I thought who better to help supplement what you're doing is our guests today, Aaron and Jamie. They really have an amazing story to tell and an amazing product that I think will interest just about everybody, regardless of your field of expertise, regardless of your profession. You will find this interesting, and you'll think of it not as a nice thing to have, but a must thing to have. So I'm looking forward to hearing what Jamie and Aaron have to say.
Great. Thank
you so much. Would you mind doing the introductions, please?
So we have Jamie Moses and Aaron Obu, but Jamie is the co-founder and CEO of Life ID, and Aaron is the CTO and co-founder of Life ID.
Fantastic. Welcome to the program. It's a pleasure to have you here today.
Pleasure to be here. Thank you,
Pleasure
Dr.
to be here.
Appreciate it.
So I'll just throw out the first question. We have people watching from all over the world, and there's so much going on, and people are really concerned about any information that we have getting out there, and also AI. There's so many different topics, but I'd like to get into what does you do at your organization, and how can you help people who are watching? Let's start with Jamie.
Again, thank you for putting this on today. We really appreciate it, and of course, Al, great to meet you as well too. And a big thank you to Rich. So I've known Rich for a long time. So when Rich started calling back and staying focused on what Aaron and I have built over the last 2 years, he became an intricate part of the team. So I really appreciate Rich introducing us to you guys today. But I'd love to get into the topic of specifically on like the show today, which is fraud, waste, and abuse, and the impact of AI and identification related to multiple factors, but specifically in healthcare. So Life ID, we focus on three things, and we do think three things very, very well. And the one is identification, which we'll get into deeper as we go along. eligibility, and of course, the third is business intelligence. So there are three factors that we heavily focused on when building the product, because I've been in the Medicaid space for over a decade, Medicare and Medicaid space for well over a decade, and trying to solve problems related to fraud, waste, and abuse with multiple companies. One company in particular, we worked with over 60 million Medicaid members in the population across the United States. And whether it be in home health care or transportation, I've literally seen multiple gaps related to fraud, waste, and abuse, and issues related to the healthcare ecosystem, about really how that impacts not only the ecosystem from states all the way down to even food pantries, but what the impact is for the actual member themselves. And when you really start to pull back and start to understand what healthcare and some of the issues related to it, over the last two years, we've heard a lot of things about fraud, waste, and abuse. And the news articles you come out once a day about a state or an issue related to it. And Aaron and I were working on this project for well over 2 years. We heavily focused on, there was a gap in identification, and then of course eligibility, and what that impact would be for the ecosystem. We realized it really makes a huge impact for fraud, waste, and abuse. Really a better improvement for the actual member themselves, as well as a huge impact for health outcomes. And when we first set out, we were working specifically targeting some of the CMS states, right, what that means and how we can make an impact. And we realized that it touches the entire ecosystem. Again, like I said, states, hospital systems, health systems, FQHCs, which we'll get into, which are federally qualified healthcare centers, or community centers, which are known, which are really vital and important to the ecosystem of healthcare, and should get more attention for sure. But also all the way down to a food pantry or food bank, which we're familiar with, and how that impacts, again, the entire ecosystem related to healthcare, and how do we improve on that? So that's something that we laser focused on. And I'll never forget giving a call to Aaron 2 years ago. And we've been working together for a long time. So we always make the joke that co-founders always meet each other at the previous startup. And then we worked together at the previous startup and multiple companies. And one thing that I always like to introduce him as the left side of the brain. Aaron and I are right and left brain. We've been working together for a long time. We can finish each other's sentences at this point. And he's someone who has been very passionate on the technical side, and the work that he's done with states as well as major payers as well. And uniquely, when we got together to be able to create this and solve this problem that really truly needs a lot of attention, a lot of focus, and we believe we're the ones to do that. When we met together 2 years ago, I'll never forget calling him and saying, "Hey, we got to fix this problem. Let's start with ID." He literally went into something that was pretty miraculous for me. I've known him for 5 years, and he started talking about some patents, which he'll get into. And once we did that, we learned how to build this out pretty quickly, and we've had a lot of great success. We know we're making a huge impact, not only for states, but of course, the government, right? So Centers for Medicare, Medicaid, or CMS. But we realize this is more of a global, right? So we're starting with US first, but we realize this is the global problem that we're willing to take on and solve. But I'll introduce my co-founder and dear friend and left side of the brain, Aaron Obo. Aaron?
Hi, thanks, Jamie. He's not kidding. Aaron Obo, co-founder, CTO, when he says that we're left brain, right brain, I really strongly believe in, and every time it proves itself out. But to pick up on what we're talking about, I had been working on some technology around advanced split key cryptography, and Jamie calls me up like he said, and it was like, how can we solve this problem? Because we try to work with other companies to solve it, and that's how we got into this identification piece, which I won't go deeper into it, but there's some unique technology behind it. It uses some blockchain, and it uses AI, which is something that I've worked on. I worked on several companies before that. And then we created this system and to be able to uniquely identify someone's ID. What we actually done is we call it creating a digital twin, because everything around healthcare has been digitized. The one thing that hasn't been digitized is the person, the member or the patient that consumes those services. So what we did was create this digital twin that's immutable, and you can follow all the services in real time in the digital sphere. And that's how we're able to track using AI to be able to reduce fraud and reduce waste and improve the efficiency of the process and of the whole ecosystem in general.
That's I'm impressed, and I mean, there's so much here. I just kind of want to simplify it, if you guys don't mind. It sounds to me like the people you want to talk to are hospitals and let's say medical systems as healthcare companies. Is that right? I mean, are they the ones you want to make appointments with?
So they are part of the customers that we serve. So hospital systems, as well as federally qualified healthcare centers. If you're just for your audience, federally qualified healthcare centers are more community centers in each states, and there's several in different communities, and they specifically focus on the entire family unit itself, right? So you have hospital systems, which we're very familiar with, which we'll call acute facilities, right? Emergencies. That's what we think of when we go to a hospital. And then there's federally qualified healthcare centers that are non-acute, which means non-emergency, right? There's like long-term, a care for that member or the family unit. And what we try to solve for related to identification was not just the member, but the entire family unit. So it's very key to focus on the federally qualified healthcare centers and what that impact is for them, not only operationally, but also financially. And that's something that we wanted to make sure we highlight as well. Yes, to answer your question, hospital systems and health systems, which we really truly make a huge impact, but also the federally qualified healthcare centers and what that means to the communities that we serve.
That's great. And listen, I know you guys are bright and you're packed with information. So to the hospital administrators out there, make an appointment with these guys. You want to hear their presentation. I've had a chance to look at it. You'll learn a lot from it. I found it to be very informative and not a pitch. It's way better than a pitch. And you guys have a great story to tell. You should get every opportunity you can to tell it. But from the point of view of a customer, let's say I'm unfortunate enough to have to go into an emergency room. It seems to me that there are two touch points for Life ID. The first is me, and me demonstrating who I am and what I'm qualified for in terms of medical reimbursements. And the second touch point is the person in the hospital who has to listen to me and prove that, in fact, I'm eligible for all these services. I say, explain to me the dynamic of how that works, because it sounds like you've got two customers there.
Yeah. So the way we look at it, it's a one single ecosystem, and that's so you've got a good point. There's the patient and the hospital administrator. What typically happens is you have to verify who you are and you have to prove who you are. So at some point in time that you're entering into the system, once you've done that, then when we create the digital twin, it's now sort of an immutable situation where every time you show up there, once you identify yourself using the Life ID, then the hospital administrator doesn't really need any much more than that, because all the elements that prove who you are have been taken care of. Now, on the hospital side, the same thing happens. For the system to be very effective, we need both sides to identify themselves as they enter into the system. Then once you're in the system, what we do on our platform is run an eligibility check real quick. It's the fastest, it's on the minutes. So that gives you an idea what that person you're talking to is eligible for. And then what we also do is speed up the process. If you have to collect paperwork, driver license proof, all of those things you can do using our app ahead of time. So once the person arrives there and truly identifies within the system, that's the person, you know a couple of things now. You know that's who they are, and you know they're there, and you also know what they're eligible for. So at the other side of it, the hospital, the FQAC now knows ahead of time what they can bill for. Now we help facilitate the submission to the state for that eligibility process. So once you go through that, you can, at least from a doctor's perspective, now you know, yes, I can treat this person and I know that I'm going to get paid. But what that does, it reduces a lot of the I would call it fraud between the 3D profile and the digital sphere, because between that and when someone gets treated, there's a lot that happens. There's a lot of waste, fraud. So we stop that even before entering to the digital ecosystem.
That's great, Aaron. Okay, so if I show up in an emergency room with my index finger in a little baggie, I obviously want my index finger reattached as quickly as possible. So in the first step, I guess, we're kind of accelerating the process of getting treatment by reducing the amount of time it takes to process the paperwork involved. Do I have that right?
That's correct. You're spot on, Al. That's good.
Okay, and on the second end of it, the hospital doesn't want to have to shell out money that it shouldn't be shelling out money for. It should know where the money is going to come from. I have to imagine that for a hospital, cash flow is one of the biggest headaches, and you help with that.
Yeah. Absolutely. So on both sides is exactly what we do. I know, Jamie, you want to jump in because that's exactly how we saw it, and it's something we've been struggling with. The entire system struggles with. How can you have those two things? And one of the key things, and I didn't even talk about AI yet, but it's having that digital footprint that connects all this together in real time. It reduces the fraud, improves efficiency, and now you can plan quarters ahead. Of course, we can talk about the HR one that's coming out that's going to create a little more challenges for patients. I'm not going to get into it here, but this really does help speed up the process.
That's great.
A question I have, because we're talking about fraud, and there are many people who think, oh, it's never going to happen to me. I don't even know what they're talking about. I hear about these stories, but how prevalent is fraud in the healthcare industry, and what is it that people should look out for?
That's a very deep question, Dr. KERBECK. The reason why is when people talk about fraud, waste, and abuse, we hear it on TV all the time, right? And I think a lot of times people focus specifically on the members themselves, right? Whether it be Medicare or Medicaid, and they heavily focus on just the member themselves. But the entire system itself has multiple industries that are related to fraud, waste, and abuse, right? And how the process is set up. And to be honest, I would tell you that I think it's really important to understand one thing. I'll pause for a minute, and I think there's a reason why there's a lot of fraud, waste, and abuse, but this is, of course, my opinion, just in my years of experience in healthcare. On the government side, I truly feel like that when there's contracts that are in place, these contracts have gotten larger and larger over time, right? And I think it's the companies who've been doing this for over 40, 50 years, and they're in the space for a long time. And there's some pretty large companies that work in the government, CMS and Medicaid and Medicare space. And I think what happens is those were smaller contracts about 20 years ago. And they've grown pretty large, right? And a lot of taxpayer dollars has been associated with that. And I think what happens is these contracts have become so over bloated that there's a lot of systems related to that are gaps that cause a lot of the fraud, waste, and abuse. So not just the member, but companies, health systems, right? Some payers, right? Some insurance companies, et cetera. And that's something that I think really needs to be focused where we see that we solve some of these issues, because contracts that exist out in the marketplace, every single time there's a new contract, contracts are getting larger and larger. So for a company like Life ID or any of the companies, anyone who's viewing in the audience, if you're in a private company and you build a company, if your company doesn't have customers, you go out of business, right? And unfortunately, with the way that the system works in the United States, related to throwing problems, like if there's a problem related to healthcare, historically we've just thrown more dollars at it, right? So if a program doesn't work, we throw more dollars. And over time, these contracts have become extremely bloated, and it affects the entire, like I said, ecosystem related to states, payers, right, and health systems, and all the way down to the member. So if I were to just kind of give you a little bit more insight of how we look at it at Life ID, is we look at it how we solve that problem. And just like Aaron said, if we truly identify who that member is, we verify who they are, and we verify who they are going forward. So it reduces massive impacts for fraud, waste, and abuse, but it also connects to the services related to that member who are ingesting those services, whether it be durable medical equipment, a brace for your arm. It's going to validate who that member is and the services that they're intaking or absorbing. And I think that's where, to answer your question, security is a major risk, but it's not just with the member themselves. Member themselves creating a digital twin, that means we now have created a digital twin going forward for that member, and we can now validate anything related to it. And one piece that we should get into is on the blockchain side, which I'll pass off to the next to my co-founder. The blockchain specifically, it's going to be a huge process on how we actually reduce fraud, waste, and abuse related to the member as well as related to the services they ingest.
That's great. I'm sorry, Dr. JACALYN. I did want to follow up on your question about AI, and I guess that's Aaron's area too, where that fits.
Yes. No, I can. I'll give you, and I'll try to simplify it, because it really, it's a topic that's everywhere today, and we understand it a lot. I think, because I used to do. So my example is when I started working on AI, it used to take me about a week, just to put it in perspective. You get a bunch of hospital data, you try to run it and create some models, and it takes a week later, still churning, and I get some results, and the data wasn't accurate. But fast forward to today, we've got all these companies, AI companies. I think it's huge for mankind. It's a huge leap forward. So we are taking advantage of that. And one of the ways we're doing that in the identification is we're going to have children on this program using Life ID. And what do you know about Life ID? Is we're not taking this. I'm not going to release some of the details here, but we're doing a vector algorithm in short. So that's a mathematical algorithm of your face. What typically happens is a child coming in at 9 years old or 11 years old is going to actually grow, right? If we're taking that number, it's almost, you have to know, for instance, that a child at 9 that entered the program is going to be, the face is going to change faster, quicker than an adult who entered at 55 or 40. So AI helps us make those reasonable, calculations that, yes, well, if a child started at 9 and at 9:30 and we take a vector algorithm again to confirm who they are, because they're in the system, then we can quickly say, okay, yes, let's make that adjustment. That's the person, with all the other elements working in place. And we also use the AI to help us figure out the anomalies. So in other words, if someone else is trying to use your identity or use some of your program, we can double check and say, all right, when was the last time we saw Al, we saw Dr. Franken? We saw them in North Jersey, we saw them in New York 3 months ago, and now they're in California. What's the reasonability that would have traveled, in 6 hours and be in California? Yeah, it's reasonable, but would they have done it and be able to get to a hospital? Those calculations are all AI driven. So all the time, to reduce anomalies, we employ AI. And then we have the business intelligence tool that's totally built on generative AI. And what it's doing is being able to make, really good feedback and predictive analysis back to like a hospital administrator, in how things are going, or looking at how the speed of enrollment, who's eligible, how many denials you have, how many approvals, if there's a claims that doesn't have, let's say, a diagnosis, for instance, that's a flag. But all of these things we can do in near real time to surface intelligence around the operation. So it's not just identification, but you have to be able to make data-driven decisions around what we're looking at, around the profile of the person. And that's how we use AI.
Okay, and I'm going to ask a question that some people might be sensitive to, who are listening to this. Obviously, the more you know about me, the better you can serve me. But I'm worried a little bit about privacy. So what's your answer to the question, do I have to worry about my data?
That's great. So we're HIPAA compliant, and that means a lot. And I can say two things. So on the ID side, and then based on the HIPAA regulations, you have a choice, right? You can decide, well, I don't want you to have my data for more than 30 days, for more than an hour. That's fine. It's your policies, your prerogative. We just have to make sure that every time you come through, we scan and have you re-register. So there's an inconvenience factor there. But we don't take photos. We don't take a picture of your face. What we do is take vector algorithm to reduce that inconvenience. And then we have multiple layers of encryption behind that. So we use a blockchain for a reason. Meaning, once we've created an identification, and we're just using it as a trust framework, we call it, and just a ledger. So we say, all right, we know who Al is. There's your ID. There's your token. It's immutable. So anyone that tries to use it, we can figure that that's who you are. But more importantly, we're not capturing your face. Someone from Instagram cannot just take your picture, scan it, and they're in. So your phone is also user's identification. So we need to know that you have that smartphone in your possession. You can try to give it to someone, but something else doesn't match, and we stop it. So if you see the tool, that comfort level is so high because we designed it with people like us in mind, and you as well, that, well, I don't want to trust someone else. We don't do the type of biometric scans like they do elsewhere where we're really uncomfortable about. So we do this vector algorithm plus a bunch of other, cryptographic algorithm to determine the immutability of that identity.
Okay.
So thank you so much. You answered my question, which was going to be about facial recognition. And of course, I'm on hiatus right now from fillers and Botox, but fillers, Botox, plastic surgery, contact lenses. So you don't look at someone's actual face. That's interesting. So my next question is for people out there who are saying blockchain, what is it? Can you give a basic overview?
Yes, I can. I'll try to do as quickly as I can. So it is a digital ledger. So we all understand ledgers and accounting, and that's where the checks and balances are. In a very simplistic manner, blockchain is kind of the same. So there are rules into putting your information into a blockchain, but then it's immutable because then it's really just a ledger and everyone can see it. So it creates, I can go not as deeply as I want to, but it creates a token that you can attach to that entry. And this is really what we're doing. You can use it for anything, contracts, facial recognition, and that's what we're using it for, just to get that immutability.
Yeah, and if I can say, just as an old banker, this is an easy example for some of your audience. When you have bank ledgers, right, you have multiple different transactions going back and forth, right? So it gets kind of complicated, multiple transfers, etc. So a way that my brain can interpret blockchain, if you can think of the banking side, is it's removing all those different transactions, right? And it's just creating a ledger with just one and two, just one transaction, right? So services attached to what it is, whether it be a banking transaction, right? You're transferring to one bank or one bank account. That's like just one actual ledger, right? And that's what it does. So that eliminates to us anything related to ID going forward is immutable. That's why Aaron keeps saying that word immutable. It means it's verifying all those services from the actual ID of that member to the services that they consume, and then that's it. And that is something that we see as a huge impact for fraud, waste, and abuse. And I hope that gives you another way to think of a blockchain. It's removing too many ledgers that currently exist in the marketplace, which also hits fraud, waste, and abuse.
That, to me anyway, that makes a lot of sense because the current system is focused on writing a few enormous checks for thousands of transactions.
Yes.
You're talking about reducing the granularity of each transaction so that I know that each individual transaction is a qualified transaction before I write any checks at all. That means I eliminate all those errors at the point of service delivery, which can save a hospital a lot of money. I want to add a question. I think Dr. JACALYN probably would ask eventually. She has a global audience. What about outside? This is a hot topic inside the United States. What about outside the United States? You getting any interest there?
It's funny you say that. I'll let Aaron jump on that in a second, but I'll tell you that one thing that we are heavily focused on, and because of our partners at Amazon, I think your audience is familiar with Amazon, or I'll say AWS, which is Amazon Worldwide Services. So familiar with AWS, we have a partner relationship with them, specifically on trying to solve some of the issues related to the most vulnerable population related to food insecurities. And that's something that as we start talking about food insecurities here in the United States, there's food insecurities and vulnerable populations across the world. And something that we started to work with and it's a new concept of working with how you connect the food services, which is called a cloud to table program. We all know farm to table. Those are the best restaurants, right? You go in, you know it's fresh. So cloud to tables obviously is on the digital side, right? How do I connect the services on farm to table, but utilizing the cloud to table? And how do I connect those same members with the food that they should be eating, right? And making sure that it gets to the member. So when you ask about that, there's a really unique way that we can use food first, right? Food is essential besides housing, right? We can talk about social terms of health and impact, but if you think about food, it's an essential piece, especially to the most vulnerable population. And shelter is always one, top above that. And I think that's something that we understand, that when you start to be able to create the technology that we've created and create it where it's accessible, easy accessible, no hardware included, right? There's no hardware included in our technology at all. And I think if you can connect that, we have a global presence, and we have been reached out to by other countries, which is great, which I'll let Aaron kind of get into without giving too much detail. But it happens to us all the time. So to your point, the more that we start communicating this out into the world, it's a simplistic process for us, but it's because we've been doing this for so long and understanding where the gaps are. So we see that starting here in the United States, but there is a need for us to do exactly what we're doing. And Amazon sees that, right? AWS saw that as a need and selected a few companies across the world. Life ID is one, to be able to combat that and solve that. And if we're solving the problem for food, then of course you can imagine solving other problems for the most vulnerable population beyond that. So Aaron will talk about a little bit about some of the conversations he's recently had with some folks.
Yeah, it's good. So one thing that Jimmy was touching on is exactly what we've designed here is a program that can fit into any type of need. So figure this: where you want to get a true identification of a person, and you want to understand what they're eligible for, what kind of services they're eligible for. And then you want to identify the providers that can actually provide that service and give a service in real time and understanding and reducing some of the waste and efficiency. So we have gotten calls from multiple different states just talking about it. I mean, I'm not going to mention any names, but they want to talk about transportation. So this technology is also applicable in making sure you get people who need the rights and have that and not abusing it. I want to say that you get them to the right place and they're not using it for the wrong thing. So you can figure all that because we have the phone and we test it. But we've got several conversations. There's one about transportation. There's one about food. Jamie's talking about, and then there's other pieces of it that just really focuses on whatever people can. It's services they have. How can we make sure we're getting it to the right people? And they always see this technology as a way to get started in improving that efficiency.
Great solution. I can see that.
Absolutely. Thank you. Rich, any questions or comments that you have for
Sure. One of the things we've talked at a real high level here, but I'm a patient and I don't have insurance. Tell me the process. So I'm going to get a link and tell me the process to get signed up for Medicaid.
Right. I'll take that. You want to handle, Jeremy?
No, let's use the left brain on this one.
So when you show up, say we're seeing you for the first time, you don't have insurance. Well, two things happen. You're at the hospital. They have to see you. So that means someone's spending time and money and resources to at least attend to you. What we do real quick is right there. It takes on the seconds, on the minutes. You can register. And it makes, and we support multiple languages. The language out there, we can support it because we want to meet that patient where they are. So if once they get that and they answer the questions, we have very simple, straight questions. And this is not anything we invented ourselves, is what, for instance, a state like New Jersey would ask, but we make it so simple and in the same kind of user experience they have with the phone. Once you complete that, then we take it and you as a patient, you can run your eligibility, but it'll return that information back in your native language, with that language you understand. So now there's a certain trust that's already being established. Once you do that, you send it to the administrator, all using the phone, all using your a mobile app. They'll get it. They see you're verified. They can also run the same eligibility. Once they do that, then as administrator, they ask you for whatever proof you need. Scan it on your phone. They have it. Through our app and our backend systems, they can submit that information to the state or to the authority. But as soon as that happens, they know exactly they're going to get paid. I mean, there's presumptive eligibility, there's full Medicaid, there's Medicare, there's all of these that have different timelines. But presumptive eligibility, you're at a hospital because you need help, you need care. So you're going to be helped. And now the hospital can collect all the paperwork. Usually it would take days, months, 90 days, we know in some cases, to get paperwork together. But now people are a little more trusting because they're in control. So there's that huge, big gap that we've closed with that trust. Get that submission and get treated. And if they want follow-up, now they can actually communicate. And then we know that was one of the problems we started out to try and solve, is where most states don't know where 60 to 70% of the members live because they're so transient. But they do have phones. We know that 98% of Medicaid recipients have phones. They have smartphones, not just phones. So there's that 1 or 2% maybe, but mostly people do. That's how we got to the solution. Like, all right, so we know where they are. If we have a phone, now we know where you are because you're just checked in. If that helps cover that.
Yeah.
And Aaron, can somebody borrow my phone? I've just signed up to get my presumptive eligibility. Can I give my cell phone to Al and he can go to it?
So that's an absolute no, because we've got a blockchain element here. So when Al shows up and tries to scan, number one, his facial vector algorithm is not attached to that phone. I mean, what I'm skipping, there are other things happening on your phone that make sure that's Al. And when Al does that, says, wait a minute, we don't recognize you. You need to prove who you are. So Al's got two choices. Give the phone back to you because he's not going to get your service. He's not going to cheat you out of your eligible services. He's going to have to register himself. And we can find out, if he's eligible to get those services. And if he's not, I mean, it's not just, saying it's not a 0-1, you're in, you're out. No, but there are other services that you may be available for, that you may be eligible for, that we can pass you down to a service provider that can help you out.
And how often do I have to sign up for Medicaid?
Well, that's another whole question. So it depends, right? So before it was every 12 months. With the new HR1, it could be every 6 months for verification, right? So when you start talking about a hospital system, specifically, or a health system, it's very important for revenue, right? So if you have someone who normally would have to reapply for Medicaid every 12 months, now in 2027, potentially every 6 months. And historically across the United States, and depending on the state, right? Some states are more efficient than others. Could take about 120 to 180 days to get approved on something like Medicaid, right? So on the services related to Medicaid. And if you can imagine a hospital system who is, busy doing what they do best, right? That's what we want them to do, is care for the member and the patient. The one thing they have to make sure they're doing is getting paid. And if a member, it takes 120 days to get approved on Medicaid, 3 months. But if they have to reapply every 6 months, there's going to be some gaps. And a lot of the states are starting to communicate a little bit more about what that impact is for not only the states itself, but also the revenue for health systems. So that's why we really heavily focus, to Al, your point, we really try to help out hospital systems. We see us as a huge opportunity and need to help hospital systems in the new world that we're going to be living in very quickly in 2027. And what we've done is make sure we communicate what that impact is for the member, and the communication on eligibility, not only just from a health system, but all the way up to the state itself, right? And that's something that we make sure that communication is where it needs to be for speed. And that's something that we've laser focused on before the HR1 that came out. That's why we truly feel we built something that was just really needed for this time frame. And we're glad we got to build it at the right time to be able to help people. So it not only helps health systems, but it will speed up the process for the eligibility for the member themselves. That was a great question, Rich. We appreciate that.
And Jamie, talk about charity care and the future charity care, and how Life ID is going to have a greater impact now for the hospitals and the members.
Yeah, so historically, hospital systems, can use more of an emergency type situation when they can't find get someone approved on eligibility. The federal government used to be able to fund what they call charity care, right? Charity care is something that a lot of states, especially in the rural states specifically, utilize that to be able to keep revenue in the hospital system. So the federal government provided the dollars related for the states, right? To be able to make an impact for some of the gaps that were associated with people not having eligibility, or the unknowns, right? People who are here illegally. And that's something that we really tried to make sure we solve for, right? So you heard Aaron talk about even children. We had to solve for multiple different layers. And when we started to realize that hospital systems were currently right now converting charity care to try to get Medicaid payments, it's a very expensive process, usually done manually. We speed up that process just using AI, right? We use the same technology. So for us, it greatly impacts the hospital system related to the topic that you just mentioned. So again, it's something that we're lucky enough to build the right thing at the right time. Aaron and I say quite a bit, but we did it before, some of the issues. So Aaron and I try to figure out if we had a crystal ball before this happened, but we haven't found it yet.
Great.
Thank you so much. I want to just go over to your website, and if you could kindly share with our audience about your solutions, because I know for me, I'm always looking, what is the solution? So tell us about these things we see here on the screen.
Yeah, so I'll take some of this. So the Life ID is the identification piece, and that's what uses the vector algorithm. It doesn't do the, I guess, invasive biometric scan. If you think about it, the foundation of our solutions is based on the thing we call Life Core, and that's what reduces the I guess improves the security and reduces some of the cybersecurity risks that are going on here. I mean, it's really, I think, if I have to brag, it's a really fast and efficient product. But it does connect to other types of standard technology. We call SAML, and all it is identifying you into some platform. And there's what we call privileged access management in front of that. So even before we pass you on, you could use Life Core. You don't have to go from Life Core to Life ID. You can go Life Core to other hospital systems. That's why we designed it that way. And the intake is a dashboard for the administrator, for the hospital, or anywhere, food bank, to be able to intake a person, send out the text message, so they can register and you could see it in real time, and then pass them on to other services that they're eligible for. The BI tool really it puts all the data together. It curates the data in a very contextual base so that you're getting the most out of it and getting the up-to-date information that you need. It's your system. We don't have anything to do. It's all curated for that provider, and we do it in real time. I could say near real time.
Yeah, and a lot of people ask the question, why did you take the time to build all 4 of these products? They worked seamlessly together, and they are much needed to be able to really kind of focus on fraud, waste, and abuse and truly impacting it, and then collecting the data on related to how it's improving. And in the background, it's constantly improving in the background with AI to constantly improve those efficiencies through the cycle. So we're talking about improvement now with, what normally takes people months to do. We're doing it within hours. Our goal is to do it within real time, exactly what Aaron just said. So that's something that we had to build for the products to be able to make sure that they work together. And a lot of times people say, are you in the App Store? We downloaded your app, and we say, listen, for a security and compliance level, right? This is very high level security. Going back to your question now about security of ID and Dr. KERBECK, same thing for you. That's come up a couple of times in your questions. You have to be invited to our apps, right? So we have to send it directly to you for it to operate the way we need it to. Otherwise, there's a lot of bad actors out there that could take some usually your information or our process. And that's something that we did as an additional security layer to be able to access any of our actual products.
Jamie, talk about what you taught me. I didn't know this existed, but doesn't mean anything. The split key cryptography. What is that?
So that's one of our provisional patents. So I don't want to get too deep into that, but I will tell you that I think it's important to understand that it's a technology that we have a provisional patent on, and that we feel very confident that it's the best technology that exists in the marketplace related to immutability and a high level of cybersecurity for an identification. So without getting too deep into it, we have solved this issue 2 years ago, again, for the need of what it's going to do for the impact of the actual ID. And we use that as the backbone of their technology. So I'd love to be able to kind of dive into it deeper, but the moment we do that, the moment we could potentially have something impact us related to a breach, and we don't want to do that, Rich. So, but advanced split key cryptography is a new concept, but it's a concept that we've been able to really rebuild out and create something that doesn't exist in the market.
What's nice about Life ID is there's no hardware to buy. You don't have to buy anything. You just have to download the app, right?
Well, I know we're running out of time, and Dr. JACALYN, you've got another show coming up, but I do want to make a point. You guys are changing the culture of hospital billing to one based on security, trust, and reliability from the current one, which is whatever I can get away with. And that, I think, is a major breakthrough. So hats off to you for that. Great work.
Thank you. Thank you.
Thank you very much for being here today. I really learned a lot. I really appreciate it. We do have your website that we are currently sharing on the screen. And then, gentlemen, we've been sharing your email addresses, but we also have your LinkedIn. This is Jamie's LinkedIn, and we've dropped the link there so that people can see that. And then, of course, we have Richard's LinkedIn. There you go, Richard. And we have Aaron's LinkedIn. So thank you all for being here. It's been an absolute pleasure, and I hope you'll come back and see us again soon.
Yeah, thanks for the invite.
Oh, thanks for having us. It was a pleasure.
Thank you again. Bye for now.
Take care.
Bye.
Well, Al, that was really a really interesting episode. I learned a lot that I had no idea about. How about you?
Well, I've been to hospitals. Fortunately not recently, I'm happy to report, but and you can it's a blizzard of paperwork and a lot of process. And every now and then you feel like whoever you are and whatever you need gets lost in all that. So anything that brings it all down to per patient, I think, and takes it out of the stratosphere of one check written to cover everything, I think will save hospitals a lot of money and will give patients a better patient experience. So this is
absolutely
definitely great stuff. And I wanted to say, I was going to say that we brought a team in, a whole team. We interviewed a whole team today. And what I loved about it is they talked about right brain, left brain. Yeah, they have their specialties, and that should be true on any team. There's some people that are better at certain things than other people might be, but it's the whole brain of the team that matters. And their individual contributions to it might come from different areas of expertise, but they all land in the same place. How are we changing the world? How are we making the world a better place? And Rich kind of is a part of this team. I think the three of them really kind of demonstrated that.
Yeah, I agree. And Rich is backstage. Let's bring him out for his thoughts. Rich, what did you think of the episode?
Honestly, I thought it was amazing. I think it's everybody's talking about waste, fraud, and abuse, but nobody's doing anything about it. And these gentlemen are doing something about it. They are making a difference. And we were in a location where we were introducing the Life ID, and they brought somebody in who was in charge of doing the Medicaid verification. And she was just absolutely blown away. And I said, well, do you want more in service? Do you need to know more? Do you need? No, it's really that simple. It's really that easy. And I said, well, how will this impact your day? And she said, I can get to my other work. Doing the Medicaid verification could take her 80% of her day. And so the rest of her work wasn't getting done. This really streamlines their work, and it ensures the patient gets the health care they need, and the healthcare organization gets paid.
Absolutely. And I just wanted to point out for our viewers, especially those who are new, there's no script. There was no rehearsal. There's no preparation. So I really felt like this was very authentic, and I understood and understanding exactly what it is that they're doing, especially from the left brain side and the right brain side. So Rich, thank you for bringing them to our platform.
Definitely. Thank you. I mean, this is what happens when you find smart people and you put them together in a room. It's great.
Yeah, absolutely. So Richard, before we log off, what would you like to share with the audience? How can people get in touch with you, and who would you like to contact you?
Sure. Well, if I work with educators, business developers, if you have a question, please ask me. if I don't have the answer, I certainly have a network of people that I can pass you off to help solve that big question that you have, that wondering. So I think one of my strengths is in connecting people to other like-minded people or to problem solvers.
And you're located in the New Jersey area in the good old US of A?
That's right. Yep.
Okay. Fantastic. Al, Cini, what would you like to share with our audience before we close out today?
Just one last thing. I'm going to put Rich Allen on my speed dial as soon as I figure out how to put somebody on speed dial on this thing. He's going to be on my list. So, but it was great. I mean, this is exactly what we look for in the business show, an opportunity to pick right and left brains of people who have built something amazing. And today was a great example of it. Thank you, Dr. JACALYN, for providing the platform.
Thank you, Mr. Cini. Who's a good client for you, and how can people reach you?
Easy to reach, Al at pro-fit4teams.com, the number 4. And my phone number is 212-480-3730.
All right, and we have that in the show notes as well. So thank you for that, Mr. Cini.
All
right, gentlemen, thank you again for being here. I look forward to seeing you in our next episode of The Business Show.
Definitely. Thanks, guys. Thanks again, Rich.
My pleasure. Bye-bye.
All right, before we close out, I have an exciting announcement, especially for all of you out there who are interfacing with customers and clients. How many times do you find yourself just giving things away? You want to say, well, no, this is my pricing, this is what I require, but instead you find yourself going, sure. Okay, we can do that. And many times it comes from a place of fear. We are afraid that we're going to insult someone or we're going to lose a potential client. Well, I'm here to tell you to stop giving away your value. I feel the same way. I've been doing it myself for years. So I've written a book called Stop Giving Away Your Value, Boundaries, Pricing, and the Business of Respect. So why don't we take a look at this movie trailer? And I am starting to tour and give speeches about this because it really is a topic that resonates with so many people. We are afraid to stand up and ask for what it is that we deserve because we're afraid that we will lose potential business or again, that we will insult someone. But we can't succeed by coming from a place of fear. We have to set boundaries. And in fact, I had a very interesting conversation with someone today, and they're looking to do a collaboration. And the person just said, well, I'm going to require this percentage of whatever we bring in. And it was a gentleman. And I thought, I am so impressed. He just said, this is what I require. It's non-negotiable. Are you in or are you out? But if the situation were reverse and it was me, I'd probably be like, well, we can discuss it. It's no longer, my friends. Stop giving away your value. And thanks for watching.
How much of your value have you been giving away? Saying yes when the answer should have been no? Lowering your price to secure the opportunity? Giving more while receiving less? Over time, it adds up. Until one moment brings clarity, you've been giving away your value. This is not about working harder. This is not about doing more. It's about boundaries. It's about pricing. It's about respect. From Dr. JACALYN KERBECK comes a direct and necessary message. Stop over-delivering. Stop underpricing your expertise. Stop negotiating against yourself. Because when you recognize your value, everything changes. Stop giving away your value. Boundaries, Pricing, and the Business of Respect. Available now wherever fine books are sold and on Amazon. A film by USA Global TV and Radio. Executive producer Dr. JACALYN KERBECK. Videographer and cinematic production Paul Garcia. Voiceover by Ed Wargas. Stop giving it away. Start owning it.
Thank you, viewers and listeners of USA Global TV and Radio, for joining us today. We're honoured to have your time and attention as part of our global community. At USA Global TV and Radio, we believe in the power of authentic conversations, meaningful connections, and creating a world of possibilities together. Want to be part of something bigger? Join our team of elevated listeners at usaglobaltv.com a space where your voice matters and your ability to listen transforms relationships. Stay connected with us across all our platforms for thought-provoking discussions, expert insights, and empowering stories. Subscribe to our channels at youtube.com/c/USA Global TV. Follow us on social media and explore the endless opportunities we're creating for growth, learning, and inspiration. Together, we're not just broadcasting, we're building bridges and changing lives one conversation at a time. For inquiries, contact us at info@usaglobaltv.com. Produced by Executive Producer and Director Dr. JACALYN KERBECK. Voiceover by Mike Porter. Creative direction by Paul Garcia. All rights reserved. Visit usaglobaltv.com to view our full terms and conditions.